Welcome to Elephant in the Room, a podcast featuring real conversations with real therapists on the elephant in every room, trauma. With this show, we are aiming to share insights from professional practitioners on trauma, its impacts, as well as various modalities and resources on healing for survivors. This podcast is produced by the Breaking Free Foundation, a Canadian registered charity that supports trauma survivors in reclaiming their lives and finding healing. All of the therapists interviewed on this podcast are members of the Breaking Free Foundation Trauma Practitioner Network. My name is Amber Craig. I am a trauma survivor, one of the co-founders of the Breaking Free Foundation, and the proud host of this podcast. Today, I'm pleased to be joined by Elizabeth Forbes. Elizabeth is a registered psychologist at Flow Psychology in Calgary. Elizabeth specializes in PTSD, CPTSD, and other trauma-related disorders. Please welcome to the podcast, Elizabeth. Thank you for being with us.
Thank you so much, Amber. Yeah. Go ahead.
So to kick off, I think the easiest question of all, which is I would love to give you the opportunity to give a little bit more of your professional background and the areas that you specialize
in. Yes, thank you for having me. My journey into this trauma-focused therapy really started in my early career when I worked in the homeless sector. I noticed that in that space, I began to see the profound impacts of trauma on people's lives. Many of the people I worked with just had endured very significant hardships, and I really started to understand quickly how misunderstood trauma is in the general population, as well as in the military and paramilitary populations. So I completed an undergraduate degree at Ambrose University in behavioral science with a focus on trauma and addiction. And when I completed my master's at the University of Lethbridge, that really became an area that I knew I was going to focus on from my work, but also just my general interest of how do we help people that are so stuck, and how, as therapists, can we actually make a difference in people's lives?
That's great. So you did mention working with military and other first responders there. So I do want to focus the majority of our conversation today on that demographic because, I mean, PTSD affects lots of different people, but this is a demographic we haven't actually focused on this podcast yet. Can you maybe share a little bit more about what led you to working with this population in particular?
Yeah, it kind of transferred over to my time working with unhoused people. I remember a specific person that we were interacting with, and he was living on the streets. And he told us this story about his family being murdered when he was hiding in a wardrobe back in Rwanda. And that sparked my interest into, okay, how as therapists, how can we help someone that has experienced just the unspeakable, the genocide and those kinds of things, and how it applied to the work that I do now is I see that very similarly. A lot of the work that RCMP and police officers and EMS and of course veterans experience are so beyond the ordinary that not everyone can really do this work. So for me, it was just a strong sense of knowing this is where I want to be. We need people that can relate to and work with people that are quite misunderstood, I think, for the most part.
I think that's well said. We have obviously worked with many first responders and veterans with our foundation. But something that comes up a lot, I think, is that there seems to be still some stigma existing within that community that I think the rest of us would understand that they face trauma all day, but they don't necessarily identify it as such. So in speaking to that group in particular, what are some common experiences of trauma that veterans, RCMP, first responders might face in their line of work?
Some examples of the trauma, and I will say this too. I often say to RCMP in particular, they experience more trauma in a morning than most of us will experience in our entire lifetime. So
Mm.
technically, there's a lot of definitions for trauma, but when we're looking at this particular population, anything that overwhelms a person's ability to cope in the moment, enacting a fight, flight, freeze. So it could be, violence, domestic violence, death, murder, suicide, ongoing abuse, mental health concerns in there as well. So the types of trauma I think are really endless, and so those are just some general ideas of what a RCMP and of course military populations as well would experience those as well.
And, as was just mentioned, there is still a relative amount of stigma, I think, with those communities.
Definitely.
And there is unfortunately some resistance for some people to take therapy or go about dealing with these traumas. So, in your
Yes.
professional experience, what are some of the common misconceptions that these
Hmm.
people have about therapy?
Yeah, that's a really great question. One of the biggest challenges in working in these populations is what you just said, it is the stigma. But the stigma is both internal and external. So many individuals in these professions feel like they need to suppress these emotions to maintain images of strength. And that obviously can lead to bottling up and actually increasing their struggles. And additionally, the nature of their work often involves repeated exposure to violence and to
Mm.
loss and all these high stress environments, and that starts to take a toll on their mental health. And so, trauma disconnects us. And so, when a person has experienced trauma, the urge to connect is not as strong as the urge, perhaps, to hide. And so that stigma keeps people in their trauma responses. It's the culture of some of these organizations as well. I've seen improvements most definitely over the years, but there still is a large stigma around pull yourself up from the bootstraps. This is what we do every day. We just have to keep going. And in the meantime, that's just not normal for people to experience that. And the last thing I'd say about that piece is, in particular to military, facing difficulties transitioning back to civilian life, and that compounds feelings of like isolation and misunderstanding. And so the trauma is, yes, what happens in the day to day in the work life, but it encompasses their entire life. And
Mm.
so, yeah, to deal with that is takes an act of intentionality. And if we just keep it down, keep it quiet, the idea is it will go away. Although we know that that's not true. So we're changing it slowly. Huh.
Yes. So
Yeah.
you just hit on something important, that it doesn't just go away. So what kinds of
No.
impacts on mental and physical health would we see happening with these populations who are not seeking any kind of treatment for their trauma?
Yeah, that's the sad part is
Mm.
the impact can be so significant. I mean, to the point where people die by suicide, So the impact can be sleep, can be mood, can be interpersonal relationship difficulties, or any myriad of those types of symptomologies. Um, and so if the culture doesn't support recognizing that and dealing with it, then they just go internal. And so it builds because trauma compounds. Trauma is stored in our bodies, not just in our brain. It is um, biology, not biography. So the story is important, but really what we're working with trauma is the body. And that's scary for a lot of people, and it doesn't make sense for a lot of people. And so part of being a therapist is providing that psychoeducational around what is actually happening to you now that you find you don't want to connect with your friends anymore, or you haven't left the house for 2 months, or whatever type of symptom that could be. Trauma seems to be the umbrella, and there's so many different things that
Mhm.
can be connected to that. It's really very individual. But I will say substance use, those kind of things
Right.
as well are part and parcel of often a PTSD type of presentation.
So not to put you on the spot with this question,
Hmm.
but something you said just kind of sparked this question in my mind is, how could these organizations and systems do things differently to change the
Mm.
culture?
Yeah, I have a lot of thoughts around that. You know, it's this tough guy, suck it up. Everyone's done this job for 13 years. What's your problem? We're all dealing with it. I had it worse than you back in my day. All of those kinds of, comments that are really just so terribly invalidating for someone living in a system that is just its own torture. I am so thrilled. Some of the work I'm doing with RCMP, what I am noticing is the higher ups are also starting to set those examples and come for therapy. And that just makes my little therapist heart happy because I know then all of the people under them are being cared for so well. So I do think it's shifting. And I think the same thing with the veteran population as well. The stigma around it is changing, but it's certainly still there. It can be seen as a sign of weakness, those kinds of things. So
Mhm. I
yeah.
think that's well said.
Hmm. Hmm.
So
Thank
just
you.
shifting perspective to a message of hope.
Hmm.
Can you
Absolutely.
talk a little bit about how therapy could benefit these populations who are dealing with trauma every day in their work?
Yeah. So I the one thing I will say is therapy in and of itself is great, but it is not always enough to get a person back to a more comfortable functioning level. There's a lot of things that are important, like choosing the right therapist, making sure your therapist really does understand trauma and understands trauma in your particular population.
Yeah,
So those things are just so important. And so therapy can help if it's the right fit. That's the biggest predictor of change in therapy, not the
right,
bells and whistles that I might have. It's my ability to make and connect with a relationship with that person, right? They're
right.
always the expert in their own life. I'm the expert in therapy, and together we make that work. So therapy then in that context can help when there's a safety and a connection piece, to process trauma, to build skills, to improve quality of life by reducing symptoms, perhaps of hypervigilance and uh, difficulties sleeping and things like that. And most of all, that reconnection and a renewed sense of purpose and connection for my person in front of me. So therapy can do a lot if it's the right fit and the right type. I often find I work with people that have been through therapy and it hasn't been successful. And that's where trauma therapy is not the same as, I'll say, talk therapy as an example, right? Probably
Yes.
preaching to the choir, but that's that's a real strong piece for me. It needs to be the right fit and the right therapy at the right time for that person. It's never a one size fits all.
Yes, I think that's exactly right. We've certainly seen we've had lots of first responders come to us over the years who actually had really bad experiences in therapy because it wasn't
Hmm.
specialized for that type of thing. So I know there's
Yes.
lots of different types of therapy and lots of different types of trauma therapy. What are
Hmm.
some of the therapeutic approaches that you find most effective for PTSD stemming from a workplace like this?
Work, yeah, operational. Yeah, operational stress injuries for sure. The evidence-based ones, prolonged exposure therapy, cognitive processing therapy, EMDR, DBT, ACT, those kind of things. But also, those are very much evidence-based. Now, we can also use best practice therapies too, even though evidence-based means they've just been really studied. So,
Mm-hmm.
but there are new and upcoming therapies that particularly I find helpful in this work: internal family systems, somatic experiencing, accelerated resolution therapy. So there are so many types of therapy. And again, I guess I would just say, the skill is applying it to make it the right fit for the person that's in front of you. And so that's a skill in and of itself because I have training in all of these areas, but it's
Mm-hmm.
certainly not going to be the same for the person I see in the morning to the person I might see in the afternoon, just always individually. Yeah. Focused. Yeah.
So, my next question is about people who are listening to this, who are not
Mm,
veterans or first responders, but they know
yeah.
them and love them. And, as we've talked about a couple times here, because there's a stigma that exists in that community and they might not be seeking the help that they need,
Hmm.
it can
Hmm.
be difficult for support people to watch that happen. So, how can friends and family who are supporting first responders, RCMP veterans, how can we
Yeah.
help them overcoming these barriers to actually exploring therapy? What words of wisdom can you give those people?
Yeah, that's such a great question. And for those that are listening, you know, l- being with your person without judgment. So people with PTSD and other trauma stressor related disorders can be hypervigilant, especially around that criticism. So listening without judgment is just such an important piece for people. And I would also say if that's hard for you, find someone for yourself. That's also important. Fill your own cup if you're living with someone that might also be living with PTSD and that sort of thing. The other thing is learn about it. Learn about what that is and the operational stress injury clinics that are throughout our country. There's opportunity for attending, some really, really cool programs. I used to work at the Calgary one, and it's fantastic. It's just fantastic. But understanding these challenges just can, and what PTSD can just foster that empathy, that connection again, because trauma disconnects and we want to reconnect. So just as a someone who cares for someone in this area, then fostering that empathy and suggesting therapy as a strength, not as a weakness. And I know that that's a big change and challenge for a lot of people. But one of the ways that I really encourage people to talk about PTSD is take the D out. It's not I don't personally feel, I don't like the word disorder. It's an
Mm-hmm.
injury. And if I'm coming to you because I have an injury, then I see you can help me. If I feel disordered, I'm already feeling icky about this relationship. So I think language around that too, even though that might not be so easy for loved ones, but to communicate that in a way that again that fosters more empathy and connection than the word disorder, because that's not, doesn't feel fair to me that they get a disorder from serving and protecting. Injuries,
I
yes,
That is
right,
a beautiful way to explain that actually, and I haven't really heard it articulated in that way, so I do appreciate
yeah,
that
thank you.
definition.
Hmm.
Um, so if anyone is listening to this now and
Hmm.
they're getting some ideas, what
Hmm.
resources or support systems are available if anybody wants to explore therapy but is unsure where to start?
Right. And so if you're a military veteran or an RCMP officer, Veterans Affairs Canada offers counseling, benefits, some case management as well. So there's VAC, which I'm an approved provider, and that's a lot of the work that I do, and a lot of the referrals come from them. The Canadian Mental Health Association, the OSI clinics, around the country. The Royal Canadian Legion, I find that some of the folks that work at the Legions are the best because they are also veterans and they can connect in a way that no matter how much training I have and all of that, it's never the same. So I always love that for people. There's Wounded Warriors and there's Here for Peers books. There's my favorite, it's a little heavy, Body Keeps the Score podcast, Trauma and Memory. And there's just so many options. So it really is just to start looking, start listening, start being curious, make a couple of phone calls and see if that's for you. Interview the therapist that you think you might want to see. Make sure they're a good fit. That's number one, because we don't always get it right, right? We just can't. Again, people are the experts in their lives. We have the expert in therapy, but the fit is the most important predictor of change. So
That
do
is
your research, do your homework, ask the questions, keep asking if you don't get the right answers, call the therapist, ask, all of those kind of things are Yeah, really important to have a good fit and successful therapy.
Those are great resources, and all of those will be listed in the show notes as well for anybody who is looking to get more
Great.
information. Just
Wonderful.
speaking to the general population, because
Mm,
there are many people outside of this demographic that are skeptical about therapy if they've never experienced it. So,
totally.
what advice would you give to anybody who's skeptical about diving into therapy?
Yeah. First of all, yeah, it's good to be skeptical. It's not a bad thing. You should be skeptical. This is your life. So ask the questions. And if the therapist can't handle it, that's not your therapist. So find someone that can hold those questions. But I would say start small. Like a single consultation with a therapist, most of us offer 15 minutes free consultation. That doesn't necessarily commit you that you have to continue. So know that. Again, find the right fit. That's a hill to die on for me, for sure. And one of the things I encourage people to do is reframe the word therapy in think of it as mental fitness, a tool for optimizing performance and health. If we framed it that way, people would come because that's what they want, right? And the other thing I would say, if you're skeptical, talk to people that have been through it, learn from what they've done as well. Often, once people come out of the PTSD kind of realm and they're into that post-traumatic growth period, there's so much to glean from people that have walked that path as well. So that peer support, that I see a lot happening in the legions in particular, with veterans, which I think is just most excellent. So yeah.
I think that's great.
Hmm.
Um, You've already mentioned some really great resources, but I ask everyone this
Hmm.
question because we always want to add to our toolkit. So, do you have any favorite resources on trauma in general that you like to recommend?
Yeah, just mostly the ones I've already discussed, but there's so many out there and they're changing all the time. So go to your podcast, provider, whatever those words are, and just start looking for other people that might have already walked this path and they've done podcasts about it. There's peer support. I think of um, mostly there's organizations that will connect you to peers as well, and those are a little bit more detailed and kind of difficult to get into in this time frame, but all of those things, just be curious, be open, just look and take what you like, leave the rest, right? It's not for everybody all the time and it might not be for you right now, and that's okay, right?
That is, yeah, very well
Yeah.
said.
Yeah, thank
Um,
you.
this has been a very important conversation. I think this is speaking to populations that are obviously significantly impacted by trauma every day, and I'm super
Hmm.
hopeful that this is going to provide some valuable information for them. So I do thank you for your insights today. Is there anything else you would like to share with our listeners before we close?
Yeah, I guess the only thing I'd say is if you're wondering if this might be for you, it's likely it is for you. Okay. Sometimes we need to hear those words and check it out. Look, and if it's not, then great. And yet it might be something that could potentially, not just therapy, but this whole process, take you out of that realm of, hypervigilance and not sleeping and, all of those kind of things into a really beautiful life where people really do recover from PTSD. I think a lot of these folks are still left with wounds, but they don't have to be disabled in that sense from this injury. So I guess I want to say there's hope. There's hope. Keep looking, keep asking the questions. And yeah, I just would love if everyone in these populations was supported appropriately. And what a different thing that would be. Much more positive, I think. Yeah.
Absolutely. We love
Mm,
to end on a message of hope. So thank you so much for those words.
yeah. You're very
Um,
welcome.
Thank you again, Elizabeth, for being on the show today. If anyone is looking for more information about Elizabeth and Flow Psychology, please see our show notes.
Thank you, Amber.
The Breaking Free Foundation offers therapy grants for trauma survivors in Alberta, and we also host 2 free support meetings a month. One is in person in Calgary, and one is online. For more information on trauma therapy and our organization, please visit us online at breakingfreefoundation.ca. If you enjoyed this podcast, please subscribe and share. That's all for now. Stay well.